vaccine record must now include the QR code in order to enter any business or venue taking part in the program. This means Alberta vaccination records without a QR code, including paper immunization records received at your vaccination appointment, will no longer be accepted. The only exception to this is First Nations and military vaccination records, which will continue to be accepted. You can visit alberta.ca/COVID records to get your QR code and either save it to your phone or download it and print it off. You can also visit a participating registry office where they will print it off for you for free, or you can call 811 to have your QR code mailed to you. Turning to today's numbers, over the last 24 hours, we identified 321 new cases of COVID-19 and completed about 6,425 tests. Our positivity rate was about 5.1%. There are currently active alerts or outbreaks in 201 schools. 10 of these schools have had 10 or more cases infectious in the school within the last 14 days. There are currently 518 people being treated for COVID-19 in hospital, including 101 in the ICU. Sadly, I must announce that 13 new deaths have been reported to Alberta Health in the last 24 hours. My deepest sympathies are with the family and friends of these individuals as they mourn the loss of a loved one, and to anyone grieving a loss, no matter the cause. Each death is a painful reminder about the seriousness of this virus and the need to keep protecting each other and our healthcare system from it. While over the past few weeks we have begun to come down the other side of the fourth wave, we have seen before how fast things can change. I would like to remind Albertans that we must stay vigilant, especially as temperatures drop and we head into winter. This is important for two reasons. First, during wintertime, more activities move indoors, where the risk of COVID-19 transmission increases. Second, it's now influenza season, which means we can expect a rise in the number of Albertans with respiratory symptoms and other illnesses, including seasonal influenza. Last year, we had our strongest influenza vaccine campaign with more than 1.1 million Albertans receiving their flu shot. Unfortunately, so far this year, uptake has been slower. At this point, about 20% of Albertans have been immunized against influenza, with more than 916,000 doses of influenza vaccine administered across the province. The good news is that there is still plenty of time to add getting the flu shot to our to-do lists. It's a free and easy way to protect your health, and it's more important now than ever. The flu shot won't prevent COVID-19, but it will reduce your chances of getting sick with influenza and spreading it to others. While the flu is not as severe as COVID-19, it can be very serious for the very young and the very elderly, and it can put additional pressure on our healthcare system. To date, we have seen 3 confirmed cases of seasonal influenza. Fortunately, there have been no severe outcomes reported. Influenza data is now reported online at alberta.ca, including the number of cases and severe outcomes due to influenza. And as we know, both COVID-19 and seasonal influenza can have very similar symptoms. By reducing your likelihood of influenza, you are reducing your likelihood of having any symptoms that may cause you to need to stay home or go for COVID-19 testing. You're also reducing the chance of spreading the virus to your loved ones, causing them to have to stay home and go for testing or perhaps having serious outcomes. Our actions and decisions have an impact on those around us, and I encourage everyone to do their part and get a flu shot. Appointments are available through the online Alberta vaccine booking system by contacting your local pharmacy or by calling 811. If you still need to get a COVID-19 vaccine dose, you can even get this vaccine at the same time as your flu shot. We also know the simple, everyday things we can do, like wearing masks, staying home when sick, practicing good hand hygiene, and limiting the number of in-person interactions we have, These help limit the spread of COVID-19 and other respiratory viruses. Lastly, I would like to remind anyone who is eligible for third COVID-19 vaccine doses about the importance of waiting at least 6 months between your second shot and your third. While it may be tempting to get a booster as soon as possible, it's important to remember that vaccine protection is not just for now, but for the future as well, and we want that protection to last as long as possible. The available evidence shows that overall protection from the vaccine is best when a COVID booster is administered at least 6 months after the previous dose. By waiting the appropriate amount of time, you will receive greater protection from the vaccine. For those who are not currently eligible for third doses, please know that we are monitoring the evidence closely and will keep you informed if anything changes. To all Albertans, thank you for staying the course and continuing to do your part for your family, friends, and community. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We do not have any media here in the room in Edmonton, so we will go straight to the phones for questions today. Operator, can you put through the first caller, please?
Our first caller is Kevin Nemec, CTV Calgary. Please go ahead.
Hi, Dr. Hinshaw. You spoke today about the COVID-19 risk this winter. Do you foresee a fifth wave in Alberta, and can you tell us a bit about what your modeling looks like?
So the risks of a fifth wave are similar to the risks that we previously talked about. So we know that transmission increases when we have people who are infectious coming into contact with people who are susceptible to the virus, and the greater the number of contacts between people, especially in indoor locations, the greater the risk of transmission. We know we still have a percentage of our population who do not have the protection the vaccine offers. And while we know that there is some immune response after infection, it's not as strong as getting the vaccine. And again, if somebody has been infected, we strongly recommend that vaccination is added to that to give added layers of protection. So with still having people in the community who are susceptible to the virus, with the very aggressive nature and high transmission potential of the Delta variant, and with the seasonality of the virus, people moving inside and having that increased risk in indoor settings, there is a risk that we could see a fifth wave. And again, as always, we have the tools to be able to minimize the impact that has, which are the things I just talked about, making sure that we're doing those regular everyday things, staying home when sick, washing hands regularly, being vaccinated against influenza and COVID-19. And those are the things that the more of us that participate in that multi-layers of protection, the less the chance of a fifth wave that could increase the strain on our healthcare system this winter.
Kevin, do you have a follow-up?
I do. You spoke about a relatively low rate of flu shot uptake so far this year compared to last year. What's being done to encourage or educate Albertans about the flu shot?
We're working with partners who provide the vaccine to make sure that it's as accessible as possible, and making sure that we provide information on our website and through media campaigns, and ultimately, again, working through our multiple channels to get the word out. Certainly that's something that as many partners as possible, encouraging people to receive the added protection of a flu shot against that other respiratory virus that is important to prevent, the better off we'll be. So I would ask that all of us encourage our family, our friends, our neighbors to step up and be vaccinated, not just for themselves, but also for our communities.
Operator, please put through the next caller.
The next question is from Sarah Chu, City News. Please go ahead.
Hi, Dr. Hinshaw. So given that COVID is an airborne virus, what do you think about encouraging air filtration, ventilators, and or carbon monoxide monitors to be installed in businesses and schools, especially as people spend more time indoors during the winter?
It's clear that there are multiple methods of transmission, and when there are multiple risk factors combined, so having a closed indoor space with poor ventilation that's heavily crowded with many people present, that of course does increase that risk of airborne spread across greater distances. So those are the factors to keep in mind if there's a business or any individuals who are looking to reduce the risk of spread of COVID-19. The things that can mitigate that, again, ensuring that there's a reduction in crowding, making sure that people are wearing masks whenever indoors, making sure that whatever possible to improve ventilation in those spaces with the assistance of certified professionals who understand indoor air quality. One of the things that's important to remember is that indoor air quality is a complex system, or indoor air is a complex system, and to improve indoor air quality, it's important to understand how any one change may impact other components of indoor air quality. So whatever changes are made, it is important to consider that in the context of the entire system, and also to consider all of those other pieces of protection that should go along with the improvement of ventilation, such as ensuring that people are staying home if they're feeling sick, all of those other things I mentioned, wearing masks, keeping distanced, reducing crowding, in addition to improved ventilation.
Sarah, do you have a follow-up?
Yes. So you mentioned that not only are, rates still increasing despite mass vaccination, it's also influenza season. So are gathering restrictions or public safety restrictions going to be tightened or loosened going into the holiday season?
I'm not sure. So I think what I talked about is the risk that there could be a potential future increase in transmission and the things that we could collectively do to mitigate that risk. Over the last week or so, we've seen in terms of our new cases and our positivity rates that we're in a bit of a plateau, but we are still slowly declining, just not as fast as before. So I think decisions about the kinds of frameworks and measures that we need to have not yet been made. And of course, whatever those frameworks and measures are that are in place, it's important not just to follow those, but also to keep in mind all of the things that I just mentioned, because we know that the more people who are vaccinated, the more people who are taking those basic measures to protect themselves and others, the more we mitigate the risks of increasing transmission over the next several months.
Operator, please put through the next caller.
The next question is from Kellen Talaguchi, Post Media. Please go ahead.
Hi, Dr. Hinshaw. Thanks for taking my question. I know you mentioned the importance of waiting the 6 months for the booster shot, but I'm curious if you can give an update on how booster shot uptake has been since the latest expansion in eligibility, and if there's maybe a timeline for when we could see more people become eligible here.
Unfortunately, that specific number of third doses is not one that I have at my fingertips, but it's something we can provide offline. Every time we know every time we've opened a new category of eligibility, we do see an increase in the number of people coming forward to receive that third dose. And so I would encourage all those who are eligible to take advantage of that additional protection at that appropriate 6-month time interval or greater. The timeline in terms of what we're looking at for consideration of any additional eligibility, we do continue to assess the evidence. We are looking to see if there's any additional guidance coming from the National Advisory Committee. So we don't have a fixed timeline on when we might be updating that eligibility, but we are always looking very closely at the available data, making sure that we are taking that into consideration as we make the decisions about eligibility in the Alberta vaccine program.
Kellen, we'll get that number for you and get it sent to you directly. Do you have a follow-up question for Dr. Hinshaw?
Yeah, thank you. And yeah, just following up on earlier where you said with colder weather you may see some more indoor gatherings, I'm curious if you're concerned about larger gatherings starting to take place indoors and what that could do.
We know that when there are large numbers of people in crowded indoor environments, that presents the highest risk of transmission. But we also know that this has been a long haul for Albertans, and so that's why we do have the framework that facilitates indoor social gatherings right now, where all of those who are eligible for vaccine are fully vaccinated. and having 2 households with no more than 10 people of that eligible age group present is a way to allow people to have that interaction while at the same time minimizing the risk of transmission. So it is important, if people are thinking about gathering together, that they do so again, either through that framework, or we do also have the ability for venues to host events through the restriction exemption program, where it's ensured that there is that check and balance on those who are in attendance to minimize the chance that those events could be large spreading events.
Operator, please put through the next caller.
The next question is from Sarah Comadina, Global News. Please go ahead.
Hi, thank you for taking my question. Lots of conversation about booster shots. I'm wondering if there's any timeline for when they will be open for the general public?
We are continuing to monitor the evidence, and what is clear right now is that individuals who don't fit into one of those risk categories that are currently eligible have very good protection against severe outcomes, even if they should have a breakthrough infection. We need to be mindful not just of our own epidemiology and monitoring that, but we also know the World Health Organization has requested countries to wait to expand the booster programs until the new year to ensure that other countries also have access to vaccine. And we know that we are collectively, as a global community, at risk of new variants if we're not able to accelerate uptake of vaccine in all countries. So there's multiple considerations when we're looking at vaccine eligibility. We also want to make sure that we don't in some ways waste vaccine protection by giving boosters too soon, which again, we're looking at not just protection right now, but we need to think about protection in the long term, and the timing of boosters and how that all fits together is something that is not a straightforward decision. So the timing again isn't fixed. It really is about looking at all of these considerations, looking at emerging evidence, and making the decisions for the vaccine program based on that evidence.
Sarah, do you have a follow-up question?
Yeah. It's been about a week now since we learned about sotrovimab being available to seniors over 65 who are unvaccinated and people with organ transplants. I'm wondering if we have any idea of the amount of people who have used this as a treatment with COVID, if there's any solid numbers at this point?
That's something that we'll have to follow up with. Unfortunately, I don't have those numbers at hand.
Sarah, we'll get that number for you and send it to you directly. Operator, can you put through the next caller, please?
The next question is from Lauren Pullen, Global Calgary. Please go ahead.
Hi, Dr. Hinshaw. Thanks for taking my questions this afternoon. You've spoken a lot today about people moving indoors over the winter and the increased risk of transmission. Alberta Health says at this point it has no plans to expand the vaccine passport or the restriction exemption program to kids 11 and under if the vaccine is approved for kids in that age range. Of course, you have said that, and we've documented that outcomes aren't as severe for kids, but you've said that they still can transmit the disease. I'm hoping that you can take me through your role in this decision and the rationale behind it, what medical info was used to make it, and how much social impacts were factored in.
What is important to remember when we're looking at that 5 to 11-year-old age group is, first of all, that, of course, because they haven't been eligible, they haven't been included in the restriction exemption program to date. And we have been able to see significant declines in our overall case numbers, despite the fact that they haven't been included. As you say, they are also the age group that is at the absolute lowest risk of severe outcomes on their own. We know from listening to parents the importance of really, for that 5 to 11-year-old age group, underlining the fact that it is a parental choice for them to make, considering perhaps with older kids having conversations with their kids. We know that there is a societal benefit to having as many people as possible with vaccine protection, because that does minimize the chances that individuals in that age group would transmit to others. But it is important to consider where a child may not be vaccinated, the impacts on their other developmental opportunities and some of the things like sports activities or other types of things that have been challenging to navigate with the older age group. And so trying to think through that whole picture of health perspective when making decisions about this particular age group and how it fits into the overall framework, all of those things have been considered. And this is something we've discussed at a national level with colleagues, again, wanting to make sure that we are really weighing, again, the that whole health picture of those 5 to 11-year-olds and all the things that they could be impacted by, especially knowing that that particular age group is at the lowest risk of severe outcomes personally as we make those decisions.
Lauren, do you have a follow-up question?
I do. I'm just hoping that you can clarify, if you can tell me if that was a recommendation of yours or not. But my follow-up question is a follow-up on the airborne question that was asked a little bit earlier. Dr. Theresa Tam tweeted yesterday about COVID-19 being airborne and how the virus can linger in the air we breathe, kind of like secondhand smoke, giving a pretty clear message about the reality of airborne and aerosol spread. Do you align with that? And will the province now start messaging this clearly so that Albertans do know that COVID spreads this way and how they can mitigate spread of this type?
We have an information sheet on our webpage that was posted in November of 2020 that very clearly outlines the circumstances that raise that risk of airborne transmission and the things that can be done to mitigate it. So as early as a year ago, we actually did have that messaging available. It is still there, and that does still line up with the evidence with respect to the transmission types. And again, we know that the absolute highest risk of COVID-19 transmission is when someone is in close proximity with someone who's infectious. And we know that when other factors are present, so again, all of those factors I mentioned earlier with overcrowded, closed indoor spaces with poor ventilation, with people not masked, when you have all of those together, that you do have that risk of prolonged duration of infectivity as well as the transmission over longer distances. So it's really important to remember that we've learned so much with COVID, and that older ways of understanding more kind of binary or categorical transmission, that it is more of a spectrum, and there are different factors that increase the risk of different types of transmission. But the absolute critical thing to recall when you're trying to minimize your risk of transmission is, again, minimizing crowding, increasing ventilation, making sure that if you're in an indoor space with those outside your own household, that people are masked, making sure that those who are feeling ill aren't attending. So there are multiple things that need to be done in addition to paying attention to ventilation.
I believe that we have no more questions in the queue. Operator, can you please confirm?
There are no more questions.
Okay, excellent. That concludes today's COVID-19 update. We will be back again next week. Thank you.